The patients who benefit most from the surgery are those who have venous leakage. This is because, as we have mentioned, the penile implant provides rigidity. However, we rely on pumping blood naturally into the male organ so that swelling and warmth occur within the male organ and an erection occurs naturally. The reason we're about now, which could leave the patient dissatisfied after the operation, is that not every patient is the same. One patient undergoes the operation because they have venous leakage, another because they have arterial blockage, another due to severe fibrosis in the male organ, another because of Peyronie's disease, and some patients have a combination of all of these conditions. Each medical condition is different from the others, and the outcome varies accordingly. So, a patient with minor venous leakage may have a different outcome compared to someone with complete arterial blockage or severe fibrosis in the male organ. The reason you undergo the operation is directly linked to your satisfaction degree after the operation. Certainly, a patient who has severe fibrosis in the male organ and has neglected it for a long period until complete organ atrophy will not be as satisfied as the man who, as soon as he began to feel erectile dysfunction, decided to have a penile implant. The nature of the medical condition dictates our approach. The patients who benefit most from the surgery are those who have venous leakage. This is because, as we have mentioned, the penile implant provides rigidity. However, we rely on pumping blood naturally into the male organ so that swelling and warmth occur within the male organ, and an erection occurs naturally. Usually, the patient with venous leakage comes after the operation happy and satisfied. The patient who has some notes might be the one who has severe arterial narrowing or blockage because the blood flow becomes very limited. In this case, we try to help them with medications that help dilate the arteries, thus increasing blood flow, and they begin to feel warmth and erections. So, the nature of the medical condition dictates our level of patient satisfaction with the implant, and not every patient is the same. The patient must understand this. The doctor must clarify this to the patient before the operation. The doctor should not just raise their expectations and tell them things that are not realistic, because when they are not met, the patient becomes discouraged. This is one of the reasons that could make the patient dissatisfied after the operation. The nature of the medical condition